muhimu sana. Tutafanya tu nitafikisha baadaye awe atuelezee kuhusu
Asante sana Bwana Chairman na karibu everyone to Diaspora University Town. Started a couple of years ago, and it actually originated from two plans. One was a housing plan and another one was a university plan. Both plans would meet at WPI University 2006 and progressed in different tracks and conferences, and then 2009 they would merge, and once they merged they became the development plan of what now we call the University Town, and from there we called it the Kenya University Project that now Kenyans are working on. So the project is for 20,000 jobs creation by the 5-year plan is what that is progressing now from 2018 to 2023. Looks to achieve 20,000 jobs created, a town developed with 30,000 residents, a university with 10,000 students, a medical hospital. We have also looked at a town bank and at least 500 SMEs. The project is anchored on Kenya Constitution, and when we started working on the project 2010, when the Constitution was passed, we tried to adjust the whole project to align itself with the Constitution and also be a project that we could actually say is also implementing the Constitution. If you read the Constitution, Article 1 that the Kenyans passed, stated that the sovereign power belongs to the people of Kenya and shall be exercised only in accordance with this Constitution. And then the people say the people may exercise their sovereign power either directly. There are two different exercises of sovereign power, directly or through democratically elected representatives. Democratically elected representation is the taxation. Directly is when you do it yourself directly, or people combine and they say we want to do this. The project is for achieving constitutional rights, and the constitutional rights land from Article 19 is Chapter 4, but the specific one that we concentrate on is Article 43, which includes healthcare, housing, food, clean water, social security. And what social security is that part of you when you feel socially that you're secure. When people wear clothes, that's part of social security. When somebody becomes old and they can't work and they have to get some money somewhere, that's part of social security. And then there's education. The Kenya Constitution 2010 had a law that was also passed, which stated that county assembly may receive and approve plans and policy for the management and exploitation of the county resources and the development and management of its infrastructure and institutions. So we wrote the plan and we submitted the plan according to this constitutional law, and it was passed by the county assembly. Just as it's written, the county assembly may receive and approve plans. It was passed by the county assembly, and once it was passed, we started implementing it in Taita Taveta. That was in May 2015, and we have progressed since then, and we are still progressing as we implement that plan. The plan itself is a GDP growth plan, or it uses a GDP growth system. GDP growth system is a system whereby you concentrate a little bit more on advancing your country GDP. For example, you look at the US, that was 8 years from 1932 to 2013, but if you look at the progress we had was from 57 billion all the way to 16.8 trillion in GDP. Currently right now it stands at around slightly over 18 trillion. Kenya itself, by 2015 it was around 54 billion. Right now we are currently estimating it should be anywhere between 80 billion and 100 billion. But the Vision 2030 goal was to get the Kenya GDP to grow to whereby it would reach the global average per capita of $10,000, which if it was to reach that at 60 million population, that would be 600 billion. So this plan concentrates on GDP growth, and as we talk about it, you see that's why we want manufacturer suppliers as opposed to suppliers, importer suppliers. As the diaspora formed itself, there was also remittances. Right now, they stand at around Kenya shillings 250 billion per year. We are projecting that between 2019 and 2023, 1.2 trillion worth of Kenya shillings coming in as dollars or pounds or other currency will come to Kenya, and this will grow the financial sector of Kenya. The goal of the plan is to bring some of that money to Taita Taveta. The 5-year jobs plan is to put 150 million hours into productive use of human resource, and at the site we are estimating 100 million. Another 50 billion we are estimating it to come through the production of materials and supplies. Time lost is never recovered, and once somebody stays a day without work, that is time lost. So our goal is to have as many persons be able to be productive, and the jobs we have will be subdivided to university jobs, that's faculty and staff, medical hospital jobs, that is the departments. I believe the medical team has got around 72 plants, which will create a lot of jobs. The design build, they will speak on that. And then we have 500 SMEs as the town achieves, and also tourism jobs. This creates the partnership, the partners, and we have categorized them into 11 partners. We have the entrepreneurs. The entrepreneurs are the persons who are advancing the project and putting their resource, both time and money, to advance the project. We have property developers. These are either diaspora or Kenyans. We utilize a system called Townhouse Development and Investment Agreement, AFIDA, but in itself it's a system for investment and directly developing property. Then we have bank developers. These are the people who are going to invest in that bank. There are several diaspora Kenyans have already started working on that capital so that we can have a bank that grows from around the site and is able to fast track the development of the project. We have that WPI as our university parent institution. The land, as stated, is 3,000 acres. That big community has put in 1,500 acres. We are looking to get the other one from, right now it falls under Constitution Article 62 1B, and we are still working on that so that we are able to advance it and it comes to the project. The other one is jobs. The partners of jobs, the persons who are going to work. We have around 300,000 expression of interest, and then the suppliers and equipment, which is the 5 million pieces of material and equipment. And this is what this workshop is about. SMEs, people will start the SMEs. One of the lead SMEs that we are going to get at the site is a technology company. It's already, the plan is already ongoing. It started by Dr. Wilson Idege of Boston, and he's looking to produce 23 vaccines and medicines. Create a plant here to do that. Then we have the Kenya banks. As we stated, the remittances, right now the Kenya banks loan advances stands at around 2.5 trillion. It's going to double by the year 2022 to 5 trillion, mainly driven by the same remittances and also the developments, especially projects like this and the big four that are started. Then we have the plan approved by Taita Taveta County. It created incentives to fund 200 students every year for the first 4 years, 10 students from each of the 20 wards in Taita Taveta. This brings a total of 800 students who will be in the university through that plan. Then the one now we are working on is the national government incentive, and we are looking to have them come in as partners. in that plan that will fund 580 students, two from each of the 290 constituencies, a total of 2,320 students in the first year. That brings both those, the county government incentives and the national government incentives, would create an opportunity to have 3,120 students in the university of the 10,000 that we are looking to have. That's the town development. Just looking at it, how will that town look like? The roads, we concentrate a little bit more on the roads, and then the plot is by the person's design. The person who wants to design, if you have your business or the university, those are the design. But the roads, we want to make sure that you have a town that is almost dark free. So the town will be serviced by both avenues and streets. And as I stated, the key part of this design, particularly on the roads, was anchored also on the Constitution Environment Right 42. It's the only constitution right that actually empowers a citizen to directly go to court. If you read it, you will see it. It says every person has a right to clean and healthy environment, which includes the right to have the environment protected, and then to have the obligations related to fulfilled under Article 70. And then Article 70 clearly states, if a person alleges that the right of clean and healthy environment is recognized and protected under the article is being or is likely to be denied, violated, infringed, or threatened, the person may apply a code for redress. So it's one of the constitutional laws that somebody has to look at very, very well when you're doing a development. And we have looked at it, and our goal is to achieve the clean air, such that we have as minimal pollution as possible inside the town. The architects, Rose, Paul, and Emma, Rose and Paul are here with us today. They will present on the design side of the project. They do visit us sometimes, but they are working from Nairobi at the moment. Whereas many people in the diaspora find mosquitoes where they live, those mosquitoes don't get inside the house. So the challenge of the designers is to come up with a design that keeps the mosquito outside. And this will include material specifications and the requirements, which will be very detailed. We can't eliminate the mosquitoes from nature, but we can try our level best to see that that mosquito does not enter the house, especially at night. The university plan has 3 schools. We are starting with 3 schools: engineering, business, and the school of, actually it's now art, science, and technology. We are working with the WPI, and why we like the WPI plan, even though it's where the plan of the university originated from 2 professors, Professor Arthur Gastenfield and the late Professor Raphael Joroge, is that the plan is, the WPI plan has become one of the best plans in the world today. Why their plan is good, you can see some of the ratings. It has been rated at in the US. Achieving #1 in the US literally gives them the #1 status in the world in some of the categories. It is also a very attractive program that it attracts 72 countries. And it has over 40 project centers in 6 continents, 25 countries with WPI project centers. Once you get started with this project, there will be a center in Kenya. The second plan that the Kenyans incorporated now inside the project was the medical hospital plan. And this specifically is anchored on Kenya Constitution 43(1). Everyone has the right to the highest attainable standard of health. So the goal is to improve that standard of health and also comply with the Constitution that a person shall not be denied emergency medical treatment. Also comply with that. The good thing about this plan is that right now 50% of the Kenyans who have relocated and found themselves in the US are in the healthcare sector. And if you asked who makes the healthcare sector the best in the world, the Kenyans are there. And that's why this plan was also inspired, and several Kenyans asked whether they could move ahead with it, and they agreed. And since then they have worked on their plan, and right now we can see the plan is progressing. It is a plan that will have a health sciences school, a university hospital, and also case management clinics. The townhouse, as we stated, is developed through the townhouse development and investment agreement. What the development system does is it simply creates a capital, a property developer capital, that assigns that capital to a specific plot, which is a design of 50 by 100, and then we bring in the loan capital, and then the house production capital is completed, and then whoever was the property developer gets their income as their capital is returned and paid back, and then the house is sold to the person who has gotten the job, and then they progressively pay for it based on through the mortgage system.
I'm a member of the design team together with Paul and Emma, who is absent at the moment. I'm going to be talking about the designs we've done so far. At the moment, we've worked on the different facilities that will be available in the townhouse. And yeah, we've been working on them progressively, and at the moment we've done almost all the preliminary designs, and now we're moving to the detailed designs of the other facilities. So, the 5-year plan, design build plan of the Diaspora University town is to build 120 kilometers of roads and infrastructure together with 2 million square meters of green space, which will include all the townhouses, warehouses, the SME property, university, and malls. And the land plots design. The plan shows different plots and what has been allocated for every plot. For instance, we have the university plots there. The small plots that you see in black, what has been allocated for the townhouses, and avenues and streets linking the different plots. The town road design, we aim to have minimal dust and pollution in the town, as well as ensure safety for pedestrians and other road users. This will be achieved through having greenery in the areas that would have otherwise caused dust pollution, planting trees along the roads to buffer noise, hence making it more comfortable for the residents that will be living next to the road. And for safety, the different modes of transport have been separated to create safety for pedestrians, as well as to make it more convenient for the vehicle use. That shows the different plots and how the sewage lanes will be linking to the sewage treatment plant. The university, this shows the university preliminary design per se. The design was made to make the professors, lecturers, and students happy and create a safe environment for all. We shall be for this, the university design will be consulting with the WPI University, which is the parent institution for the university, that we intend to come up with the hospital design, that's the plot layout, showing how the different buildings in the hospital, medical institution, and how they'll be linking to the other roads of the town. So that's the plan. The design goal of the medical hospital is to ensure treatment, to be part of the treatment, as we ensure patients and medical staff and workers are safe at all times. We have heard from them that all patients have a right to emergency medical treatment, so we also have an emergency department. The townhouse design, the design shall create a good and healthy living environment through building incorporation and material specification. The design will have different variations. Yeah, the way you use the space, even if it can, the way it is, it's a five-bedroom house, but you can split it, say one side to be made a 3-bedroom house and a 2-bedroom house. The way it's, like the plan allows for that. We shall show you the detailed designs, which I'm not here at the moment, but maybe the next program. Yeah, that shows the design of the townhouses, perspective, street perspective. these are other models of the townhouse, so you can customize depending on your needs. We'll make it possible to have solar panels installed so that we can enhance solar use. Houses that will be built first, we have to utilize a septic tank before now we can direct it to the sewage treatment plant. So that section there shows how the waste from the washrooms and from the kitchen is directed to the septic tank, and how it will eventually move from the septic tank to the sewer line. And so this one shows a townhouse which has a provision for a pool. So in case you need a pool in your house, we have provided for measurements and where you can install the pool. It can be detached or raised or dug in.
But if you go to our website, you get a background of the project. You will see 2006, Professors Adagastel and the later Professor. They will start the idea. Currently, we have the trustees. This keeps on expanding. So basically, we are getting more and more people involved because it's a big project.
What arrangements are there? Can I buy that plot in installments, 500,000? You see your company 250,000 down payment? Organized. I mean, a media something like that.
What we're going to do, and that's why we are trying to convince the diaspora now to also bring the money through a banking system. Because once we set up the banking system, it's a little bit easier now to come and say, we are going to be lent that amount you paid in 60 months. So now you become a townhouse developer.
The item he asked about the pieces of land, how the members get titles on them. Because there's also another line that's being propagated that the land was given to Diaspora, they are divided it and they are selling it at a cost of 500,000. That is misinformation. Because I think if you look at it, you are investing into the project.
Any house that are in any big project, that house, many of those titles never leave the bank. Because at the end of the day, what you're looking to, if you're going to have a house of 5 million, and you're starting with 200,000, who brings the 4.8 to the bank? So basically that title never leaves there. The bank has to be paid, and the person who invested has to make a return. Like somebody will fly from Jomo Kenyatta, land in New York with $1,000. Within a month, he's gotten a job. Within 2 years, he's living in a house like that one. Ameanza kulipa mortgage. Within another 15 years, who created the opportunity? The guy who created the job and built the house. Who shared the amount of money for the building of a house? The material supply and the labor supply. So that's how you advance it. Don't stick only on the land side so much, but also the production, the human resource side, because the human resource is the actually one thing that fueled, and we have written it again. There was the president, when President Kenyatta visited Boston. He actually stated the same thing. The human resource is the biggest, most valuable resource in any country.
I have a concern. First of all, congratulate Bwana Chairman, Bwana Manda, and all the DRB members, committee secretary. My concern is, yes, we are going to supply the building materials and so forth and many others. But now the issue is, after the supplying of the materials, the structures are there. We'll be having the hospitals, we'll be having the university. What plans do you have to get the community, the people who are around the university, to work in those hospitals, to work in those universities as lecturers? Are you having any plan to give scholarships to the people around the Darabi branch?
I'll answer that. If you had come on, one of the incentives passed in the project was 200 students would actually be absorbed 10 from every county. That is already inside the project. So 800 students will have to Number one, you can sustain a university into the future, 10, 20 or 30 years, if you're not the people around it. So you have to actually build those people around it. It's a must. That is not negotiable. You can't start something that without people around it building up. So if you are to ask me who is going to benefit most, it's the people around it. They are the key beneficiaries.